So there are 5 best practices in the emergency department that we can execute to differentiate ourselves and take great care of our patients. The first one is leader rounding on patients, staff rounding on patients, bedside shift report, discharge phone calls, and leader rounding on staff. Published emergency department literature shows that when patients come in for care, they want 3 things. They want their pain to be managed, they want to understand their plan of care, and they want to also know their disposition or their delays, if there are delays that are going to occur with their disposition.
We see patients in the emergency department tend to be at their worst. Either they are sick or their family members are sick, or they are hurt, but it's the worst day of their lives. So we have to step up and be that security for them, to make them know that they are safe, that they are being well treated, to get them back to their normal everyday life.
Hi, Ms. Jones. I'm Leslie. I'm your primary nurse. I'm gelling in for safety. Who's with you today?
I'm Caitlin. I'm her sister.
Hi, nice to meet you,
too.
Caitlin. So how are we feeling right now?
Not very good.
Not good?
Yeah.
Okay, so you weren't having pain earlier. Let me adjust this. Is this comfortable for you?
Okay, yeah, that's
Okay.
fine.
So your pain's changed?
Mhm.
Okay, so tell me about what's going on now.
I'm getting kind of a sharper pain.
A sharp pain? Okay, and can you tell me where your pain is? Does it move?
Yeah, kind of just up here in my arm.
Okay.
Yeah.
And what would you say? I love patient interaction, and one of the things I love the most about patient interaction is being able to help someone on the worst day of their life. Their emergency is their emergency, and it's the worst thing that's ever happened to them. So to be able to guide them through that and let them know that it's okay is one of the great joys that I have in my job. Okay, I'm going to give you the call bell so that you have that in case something happens. Before I get back, immediate attention, we will do that.
Okay.
And I'm going to put your side rail up for safety, okay? Because I don't want anything to happen to you. Is there anything else I can get for you right now?
No, that's fine. Thank you.
So I'll be back in a few minutes to get your pain medication, and we'll take care of that. And we'll be checking on you every 30 minutes while we're waiting for your lab. So we'll get this taken care of for you, okay?
Okay.
All right, thank you.
Thank you.
Do you mind if I pull your door up for privacy?
Sure.
All right, thank you. We'll be right back. As a nurse on a unit, I think the difference is we're being more proactive instead of reactive, and we are getting in there and getting what the patient needs before they ask us for it, and just recognizing that we need to continue to check on our patients more frequently.
Purposeful leader rounding on patients in the emergency department is intended to achieve 3 things. The first thing is ensuring safe, high-quality care. The second thing is an opportunity to gather reward and recognition for the staff member. And the third is to identify any trends that may be occurring so that those can be corrected in the moment.
Hi, Ms. Jones. My name is Kelly. I'm the director of the emergency department. I'm gelling for your safety.
Okay.
How are you feeling?
I'm feeling pretty good.
And who's with you today?
This is my sister.
Hi, I'm Kelly. Nice to meet you.
Nice to meet you too.
So how's our team doing taking care of you today?
You're doing very well.
Great. I see Dr. Hickey and Lawyer taking care of you.
Yes, they are.
And do you know what you're waiting for?
I don't actually.
You don't? How's your pain?
It's not bad.
Good. Are you at a 0?
Yeah, I'd say
Okay. So according to the board, it looks like you've had your blood work and your EKG and you're waiting for your 2-hour.
Okay.
So I'd be happy to go ask Lori when your blood work is due. And our goal is to get in here every 30 minutes to check on you to see if you need anything. If there's anything of urgency, please feel free to place the call bell.
Okay.
So if you don't have any questions, I'm going to leave you my card. If anything changes, please give me a call. Thank you so much. It was nice to meet you.
Nice to meet you too.
Would you like
Leader rounding on patients is meant to be positive and not punitive. It's a way for us to garner reward and recognition for the staff, but most importantly, it's a time for us to look at whether or not the workload allocation for that day is appropriate. So if we have a staff member who may be struggling and is not able to get in there and meet with that patient or interact with that patient and round on them every 30 minutes, let's look at the assignment board for the day. Let's look at additional resources that are there within the department. We want to make sure that we have a strong, positive work environment for our staff so that we can deliver excellent care with high service to our patients every day with every interaction in the emergency department.
Would you like me to close the door on my way out for your privacy?
Sure, thank you.
Great.
The difference since we've been doing leader rounding and hourly rounding on a consistent basis is we have seen that the team is highly motivated to go above and beyond. We are proactively meeting needs as well as ensuring safety and comfort on a consistent basis. In fact, I have had patients tell me that when they come to a facility, they understand that people are credentialed and they have licensure. What they don't know is how they're going to be treated. And they hope that that treatment is the same throughout. And time and again, since we've started these rounds, I am hearing from our patients the consistency with which we're delivering that quality, safety, and service. Are there any other concerns that you have that you'd like to discuss with me prior to me leaving?
I just really wanted to know the results so I can go home.
I'll make sure I get a time for you of when those results will be ready.
Thank you.
Okay. So before I leave, I'd like to offer you my card. It has all of my contact information. I come around about every 2 to 3 hours to ensure that everything is continuing to go well for you. I'd like to give this to you. Is there a place I can put it that's convenient for you?
Let me just hold on to that right now.
Okay, excellent.
Thank you.
So I hope you feel better.
Thank you.
When I come around again. I hope not to see you and that you have your lab results and everything goes well for you.
Thank you very much. I really appreciate it.
Excellent. Thank you so much for your time.
Thank you very much.
May I close this door for your privacy?
Sure, can you kindly do that for me?
Absolutely. Thank you so much.
Thank you.
Bedside shift report is very important to the patient and to their family members, and also builds trust. It builds trust from the patient perspective with their healthcare delivery team, with our team, our staff, and our nurses. It's also there's also a safety component to bedside report because we're handing off care from one shift to the other so that care continuity continues and flows without any minor or major disruptions.
Hello, Miss Jones.
Hello.
This is Robin. Robin's going to be taking over for me.
Hello.
This is her sister, Kaylin.
Hi, Caitlin.
Nice to meet you.
We're just going to give a quick little shift report, take about 2 minutes. You want to tell Robin a little bit about how you came in today and what brought you here?
Yeah, I was having some chest pain about an hour before I came in, so I called 911 and the ambulance brought me in.
Oh, that must have been scary.
Yeah.
Were you with her?
I was. It was a scary ride, but we're here now.
Well, hopefully we'll have a good outcome for you.
I think so.
I was telling Robin that we had given you some morphine. Has that helped your pain at all?
It has, yes.
Good, good. Remember also I said that it would cause you to be a little dizzy, so I want to keep this rail up just to keep her safe, if that's okay.
Yeah,
Thank
that's great.
you.
Thank you.
I know you're right here with her, but this can never be too safe.
Yeah,
I'm going to update your board here. I'm going to take Lori's name down and put my name. And what is your pain at now?
Say about a 2.
About a 2, perfect. All right, and then also the doctor's ordered a CAT scan for you, so I'm going to mark that on here.
Okay.
And the blood work is still blank because you're going to have that second set of blood that's going to be drawn in about an hour, and they'll also repeat your EKG and hook you up like they did when you first got here, okay?
Okay.
Any concerns about the cleanliness of your room that I can take care of?
No, everything seems great.
All right, great. I'm going to be around every 30 minutes, just like Lori has been today,
Okay.
to help assist you with any needs. If you need to go to the bathroom or need anything to eat or drink, you can let us know during that time. If anything emergent arises, just hit this red button, and we'll come back and take care of it, okay?
Okay, great. Thank you.
It's been a pleasure caring for you. I hope you feel better.
Thank you very
Thank
much.
you.
As I
Let us know if you
continue
need
to-
anything, okay?
Thank you.
Thank you.
All right. Would you like your door shut for privacy?
Sure, that'd be great.
All right, and I'll be back in 30.
Okay.
Bedside shift report is an opportunity for us to build and strengthen our trust between our patients and family members as well as our caregivers. Bedside shift report is something where the patient should be an active participant in. They're part of our healthcare delivery team, particularly when they're starting in a vulnerable place such as the emergency department. We need to make sure that they are informed about their plan of care, that they are educated about their plan of care, and they can be active and engaging participants. Oftentimes in our verbatims, we'll hear patients say that they didn't understand, or they didn't know what their discharge instructions meant, or they didn't know why they were waiting so long to get admitted. When we include the patient in bedside shift report, we're mitigating those fears. We're keeping them informed. We're letting them know what's going to happen next. We all want to know what's going to happen next.
May I come in?
Sure.
Miss Williams? I'm Dr. Semshishin, one of the emergency medicine physicians here. Feel free to call me Dr. Mike. Very nice to meet you. What brings you into the emergency department today?
Came with some stomach pain.
Some stomach pain?
Yes.
How long have you had it?
It's been a while, but it's been on and off, so I can't really remember when it started.
Is this the first time you've ever had this kind of pain?
Yes.
Where's the pain? So here in the emergency department, we really initiated a campaign to really attack patient satisfaction and try and consistently increase our scores. As a group, we really wanted to make sure that our scores were reflective of the care that we felt that we were delivering. I'm going to perform a brief physical exam if that's okay. We sat down as a group and we kind of brainstormed and thought about some different things that we could do to consistently increase our scores. We discussed, some of the various steps such as knocking on the door, introducing yourselves and things of that nature. We really wanted to kind of think outside the box of some things that we could do to really get us to that next level and make us sustain at those levels. One of the things that we discussed was we actually had a campaign where we actually did have some shadowing. A few of the physician leaders did follow some of the physicians around during their daily routines to really discuss some things with them and then afterwards give some feedback. I mean, often physicians don't realize some of the things they do when they're speaking to a patient, possibly their mannerisms or possibly if they're speaking in a rushed manner. So really to be reflective on some of the things was extremely helpful, and we found that it actually did improve physicians' behavior with patients. There are a few things that I'm concerned about that I think we have to do some tests to examine. Ovarian cysts would be one of those. So what I'm going to do is go ahead and get some blood tests on you, go ahead and get a urinalysis. Bathroom's actually right across the hall. You're ready to give a sample, look for infection. We're going to go ahead and start with ultrasound to evaluate for an ovarian cyst. Would you like anything for pain or for nausea right now?
Yes, because the one they gave me earlier didn't last for a long time.
Okay, no problem. I see that Cindy is your nurse today. John will be your tech. Fantastic staff today. Cindy's a fantastic nurse, and she should be in very shortly to get you some medications. So I'm going to go ahead and talk to the nurse and make sure she gets you those medications and get those tests started, and then I'll come back in about 5 minutes and complete the interview with you. I'm going to go ahead and leave you one of my business cards just to provide you a little bit more information about me and our department. If you have any questions that you think of, you can go ahead and write them on the back of the card, and I'll be back in about 5 minutes to finish things up with you. Do you have any questions for me?
No, thank you.
All right, I'll be back in just a bit.
Thank you.
So physician photo business cards provide some information about the physician taking care of them, such as their education, hometown, some of their personal interests. When a patient comes to the emergency department, they usually have no prior relationship with the physician taking care of them. This really gives an opportunity for the physician and the patient to interact on a more personal level and make the patient feel more at ease.
Hey folks.
Hi.
Hey. Dr. Hickey, haven't had a chance to talk to you before. Is it okay to talk? Okay.
Yeah.
So while you've been here today, you've had a lot of tests done. We were waiting on doing this second EKG, which looks great.
Okay.
The heart proteins that go along with this that the nurses came and took from you look perfect as well.
Okay.
The CAT scan of your chest looked good. It didn't show a blood clot in your lungs. Didn't show any pneumonia. There was nothing there on that scan that was worrisome. The rest of your labs have been okay. Do you all have any questions?
What about the gym?
Yeah, I like to run a lot. Is that something that I can still do, or?
I think going to the gym is totally fine.
Okay.
I would like you to follow up with your primary care doctor sometime in the next 24 or 48 hours to have them review everything that we did today and maybe talk with you about what your risk factors are for developing heart disease. Today we're able to tell you that you haven't had a heart attack, and we're able to tell you don't have a blood clot in your lungs, and we're able to tell you don't have a collapsed lung. But we're not really able to tell you what your risk factors are for heart disease, and that's where your primary care doctor would come in to be able to help you out with that and further sort it out.
Okay.
So maybe wait on the running until after you follow up with them.
Okay.
Do you have access to a primary care doctor?
I do,
Okay.
yes, thank you.
All right. And do you all have any other questions?
No, just relieved, but we will follow up with my doctor, so
Okay.
thank you.
Well, that's great. So our nurses will come in, who I know you've been working with all along, and they'll get you your IV out, and they'll get you so you can get dressed, and then I'll go put your paperwork together. Do you need a work note?
Yes, please.
Okay.
That'd be great.
And then we'll get you out of here.
Okay.
Focusing on a patient-centric model, good care is caring for the patient's disease. Great care is caring for the patient.
Now this is probably one of the most vital components to increasing patient satisfaction. There's really nothing better for a patient than to get a call from their physician asking them how they're doing, how their care was. And it's actually extremely rewarding as a physician to call them and have them actually say, you know, thank you so much for calling, or I'm doing much better. It really makes our job much more enjoyable, and I feel that's a huge, huge, huge piece to increasing your scores and sustaining them.
Hello?
Hi, Mrs. Johnson. This is Dr. Paganusi. I'm the physician who saw you in the emergency department yesterday.
Oh, yes, yes.
I'm just calling back to see how you're doing, to make sure things are better, your cough is improved, you're tolerating the antibiotic, and to see if you had any questions for me.
Oh, everything is going so much better than the other day. I really appreciate it, and I can't even believe you're calling me, so thank you.
No, that's great. Thank you for having the confidence to come to our department. Were you able to make a follow-up?
Absolutely. I have it for tomorrow.
That's fantastic. Listen, just so you know, I will be back in the department myself working from 8 to 6 tomorrow. So if you have any problems or questions, or should your doctor have any questions about the therapy you received yesterday, please feel free to have him call me.
Oh, that's fantastic. Thank you very, very much.
You're welcome. You take care.
Thank you. Bye.
Bye-bye.
Discharge phone calls are important to make consistently because they allow us to address additional concerns the patient may have, as well as address any follow-up items the patient may need us to, as well as allow them to reflect on their entire experience here to possibly positively recognize any team members they have come into contact with.
I don't think any of us as clinicians can argue with that statement. Then it becomes a matter of how do we do them and how do we incorporate them into our day-to-day practice. Many studies have shown, many emergency department literature, published studies have shown that discharge phone calls improve clinical outcomes, that they reduce readmissions, that they decrease complications, and oh, by the way, they also satisfy our patients. So there are 3 clinical outcomes associated with a 90-second phone call to our patients to make sure that they're doing okay. We've proven it within our division. In certain hospitals where we are already achieving phenomenal results, that our patients recognize the importance of service excellence. These 5 key tactics must be delivered in every emergency department, every day in our division. It's our strong commitment to high quality, excellent care.